Hi, everyone. I'm Victoria Dunkel, and welcome to the Live Better, Feel Better podcast here at AdventHealth. And it is great to see you again. And I'm excited to introduce you to this week's guest. We are here with Dr. Colette Salm-Schmid, and she is our fellowship-trained breast surgeon. And she's a pretty interesting person to get to know. So we're going to do that. Hi, we're going to do that today.
Hello. How are you today?
I'm good. I'm glad we
Good.
could get a couple minutes of your time. You are one of the busiest doctors around, not only caring for patients, but also making sure that the message about the type of care and community that you really thrive and welcome is getting information we need. So let's just start with that. Tell us a little bit about you and your call to be a doctor. What made you want to be a doctor?
Oh, that's a very tricky question. I didn't want to be a doctor always.
Ah,
I grew up and I thought that I was going to be a swim coach. And I actually went to college and I did some graduate work and I was an assistant coach. And I was working with swimmers at the college level that were shaving tenths of a second off their time.
ooh,
And as part of my coursework, I had to take an anatomy class.
okay.
And I was like, "Oh, wait a second. Time out, time out. This is too cool." And so I took courses then to go to medical school. I really thought I followed my primary care provider around. I'm kind of a people person. I like connection. I thought that primary care would be perfect for me. I was a secretary for the primary care club in medical school. And I actually took surgery first to get it out of the way.
Really? You just wanted to check that one off
Yep,
because
my very first clinical surgery, get it out of the way, move on, and loved it.
wow.
It was very much like a sport. The more you do, the better you get. So there was technical, physical aspect to it. There was also the sort of intellectual aspect to it too.
Certainly.
And so when you match out of medical school, I
Mhm.
actually ranked primary care programs and I ranked surgery programs because I interviewed at both and I let the match decide.
Really? Like a flip of the coin almost.
A flip of
That's
the
pretty
coin.
daring for your future in a profession like medicine.
Yeah.
Did you feel lucky?
I was excited, but at that time I was married, and my husband and I said that we would reassess each and every year.
Okay.
So that if I was turning into a monster, that I would stop and I'd do primary care. And so each and every year we'd reassess, and he'd send me flowers, and we kept going. And then as time went on, I decided I wanted to do subspecialty work. I wasn't sure which subspecialty I wanted to go into,
Right.
but I thought I wanted a lifestyle of a subspecialist because instead of
Well,
being really broad, I wanted to be really good at something.
let's take a moment and talk a little bit about that so
Yeah.
that folks who are watching who are not as immersed in medicine
Yeah.
as we both are now in my role telling your stories, but in your role as a doctor. When we're talking about subspecialty, when you choose or you are matched with surgery, there is a path of general surgery where you can operate on
Mhm.
the body. But you wanted to break that down and kind of hone in on a specific part of our bodies.
I did.
So tell me what made you go, I want to narrow my focus of expertise.
Well, I had an interest in breast cancer for
Okay.
sure. From the time I started my residency for
Yeah.
general surgery, I had an interest. So every year I would go to a meeting and of a breast surgeon, a very famous breast surgeon in Chicago, and she had a meeting every year in the fall, and I would go. But I was spending 5 years learning how to take gallbladders out, appendices out, colons out, and that was fun. And I hated to waste that. I remember making a terrible faux pas. My last year, I was so nervous to talk to her, but I always made a point of going up and talking to her at this meeting. And she said, "Well, how you doing? Are you getting ready to figure out what you want to do?"
Yeah.
And she's a world famous breast surgeon. And I said, "Well, I really like breast cancer cure, but I'm afraid I'll get bored." Oh my
Oh,
God.
no. Well, you know what? But
She
you were being honest, weren't you?
I totally was being honest.
What'd
And
she
I
say?
totally like my face went white after it came out. And she looked at me and she's like, "Huh." And
Right?
right. And I thought, oh my gosh, whatever. And so I finished my residency and I actually applied to her program, which is a program I ended up going to
For your fellowship?
for my fellowship.
Wow, okay.
Yes, but I also applied to trauma programs. to do trauma surgery because it's a little bit more shift work, and I thought
Sure.
that would be better for a family because family is important to me. And but in the end, I got into both and had to decide. So this time I
Okay.
couldn't let the match decide. I actually had to make a big adult decision,
Yeah.
and I decided to do cancer care. I thought it would be an intellectual sport as well as a physical sport. And my family was immersed in cancer.
Really?
Yes.
When you say that, let's talk a bit about you are talking about were they experiencing cancer in their personal health?
Well, it's interesting. The person I was named after
Uh-huh.
was also my godmother. She died of breast cancer
Oh.
during my residency.
Mm.
She had breast cancer for 38 years, but then it went to her brain, and then she died of breast cancer. She was the dean of a nursing school. She was an interesting person. My father had lung cancer when I was 19 and died.
Oh, I'm
And I
sorry.
remember even in college doing a talk about immune therapy before immune
Oh my
therapy was
goodness.
anything. And so I had an interest in cancer. And then my father grew up on a farm after
Okay.
World War II.
Uh-huh.
He had he had 13 brothers and sisters. That's a big farm family.
Sounds like my mom's family.
Yes. 12 died of cancer.
Wow.
And no genetic defects, likely environmental exposures.
Probably, right?
So I knew about cancer.
Oh.
I went to funerals. I knew about different cancers. I knew about so my family in some way was really immersed in cancer. When I was a fourth year resident, so there's 5 years of general surgery residency. When I was a fourth year, my mother-in-law got cancer.
Oh, wow.
I remember she taught me a lot actually, which is
Mhm.
interesting. I was pretty young when my dad died, so she taught me a lot about it. She had head and neck cancer, which at the time we didn't do very well with
Mhm.
chemo or radiation. We didn't have the tools we have today.
Correct.
And I was on my ICU rotation, and I would call her like after 11, and she would be up,
Mhm.
and we would talk. And I knew that the chemo and radiation wouldn't help her. And I remember having this frank discussion with her about that. And she said, "But you don't understand. It gives me hope." And I'm like, "Oh,
Okay.
right. This isn't a follow the research thing. This is really about her as a person and not wanting to give up yet."
Was that a pivotal moment when you had, like, the realization that all the science knowledge, all the surgical skill would be, become secondary to that relationship that you would build with your patients?
I think so. I also remember I was an interpreter of information for her all the time. People, she would come and she'd say, "Well, I talked to the doctor and this is what they said, but I don't know what that means."
Mhm.
I remember understanding that our medical language is a foreign language to most people.
It really is, it's so confusing.
And so part of our job is just to be able to translate
Mhm.
and what it means to people. I also remember from when my father died, though, that cancer is such a roller coaster.
Oh, sure. It is.
So one minute they tell you there's no cancer left, the next minute they find mets. The next minute they treat the mets, and then they tell you there's no cancer left, and you're on the roller coaster.
Yeah.
And it's a roller coaster gathering information. It's a roller coaster during treatment, and then there's a whole process of dealing with now what. And so I was aware,
Mhm.
maybe more than most people, because I had so many people around me that had cancer, felt the roller coaster, didn't understand, needed interpretation.
Mhm.
That I think that I felt that I had particular skills that would be helpful.
So, what you just described is a perfect setup to something that we offer here with our AdventHealth Cancer Services. And I see your face lighting
Yeah.
up. It's because we actually have an amazing team of really incredible cancer navigators. And it's not just a broad one, they actually specialize in different. The medical term is tumor sites, but the different types of cancers that
Yeah.
so often people hear their doctors say, I've got news, and the diagnosis is breast cancer, lung cancer, and so on. Let's talk about our navigators.
Yeah, the navigation idea at Advent Health is it's not a new idea around the country,
Mm-mm.
but as we get rid of resources for healthcare, there are programs that are eliminating navigators, and they're so vital. There is something to be said with somebody walking alongside you during that process that you can call at any point about anything in the process. It could be financial and you're just getting stuck on forms. It could be trying to get your imaging because you can't do the next step until you get that MRI.
Mhm.
It could be about hey, I just got this report back and I don't know what it means. Can you help me? It could be like, how do I get a wig? Where's the most common place?
Right.
So we all need a friend to walk alongside us, and we all don't necessarily have one that knows how to do the healthcare system. So I think the navigators really are a person to walk alongside with you that really makes a difference.
Absolutely. I mean, we've had the chance to share many stories, and I have people reach out and say, "Oh my goodness, this navigator, that it was the change," because especially their family wants to be there to support them, but they don't know the health system either. So how having that navigator lift that portion of it and carry it while you go on that journey together is so powerful. But what about some of the other things that are going on with our cancer services? Obviously, having a fellowship trained breast surgeon here on our team is a game changer when it comes, especially for women who are have that mammogram and something shows up. They discover a lump during their regular breast self exams, whatever the situation is that leads them to taking that diagnostic step. And now you're right there, ready to step in and help them with all the questions that come in.
Well, breast is an interesting area. It's kind of in between internal medicine, general surgery, primary care, OB. Everybody gets training in some breasts, but nobody's really an expert.
Okay.
And if you're a general surgeon, I really want you to know how to take out my gallbladder, take out my colon, take out my appendix.
Sure.
Breast is important, but we got just a little bit of training in that. Internal medicine, I really want you to know about my heart and lungs and all those metabolic things that you need to know. OB, make sure you help me take care of my private parts, but breast isn't necessarily their forte. So, fellowship training in breast really helps us hone in on all the important things as well as the zebras that are in breast care. And
Zebras? What's a zebra in breast care?
a zebra in breast care is just something so unusual that nobody's seen before and they don't know. And so every now and then we run into that, but you need somebody to help you through that
Hmm.
because not everybody knows what it is. So, my role really is to make sure that people understand what they have, what they're doing, whether it's mundane and easy or whether it's one of those zebras. And so I think that that's important. I also think that in this area, so part of the reason I came to this area is because you don't have a lot of fellowship trained breast surgeons.
No, it is a
And
need.
people were really traveling. They were traveling to Atlanta, they were traveling to Raleigh, they were traveling to Charlotte to get their care because they didn't they didn't necessarily have the resources they had. So, it's always nice to be in a place where you're needed, and clearly, I think Western North Carolina needed another fellowship trained breast surgeon.
I couldn't agree more because it seems that we are seeing an increased number. Of course, we have an older population, so that puts you into your mindset, okay, breast cancer risks go up as we age. I also have friends who are below that magic number that we used to think was I'm safe until then. These are women in their 30s
Mhm.
and even sometimes younger developing breast cancers. Um, what is going on that is causing us to have that situation? Because we're hearing, exposure to plastics in our food, processed food, so many different things that might be getting the cause of the day, if you will. But what are you seeing as leading to these anomalies? Well, things that used to be anomalies, but now they're getting a little more common.
Yeah, I think it's not a single thing or we would have figured it out by now. So we'll
Oh,
start
that's
with
true. I
that.
guess you're
I think we
right.
would have
Yeah.
figured it out. However, there's
Mhm.
a couple things that we can point to. In terms of just feeling like it's everyone, we have to understand that the baby boomers are now in the age group to get breast cancer. So it really is a big group of people getting breast cancer right now.
That makes
So
sense. That's
even
numbers.
if it's 10% of a big number, that's a lot of people. So it feels like it's everywhere. The next thing is we went through a period where we really used hormone replacement therapy, oral contraceptives, and all kinds of things. And we have some contribution from that era.
Okay.
We also have an entire population getting their menstrual period earlier.
That's true too.
Yeah. And so now we think that it might be trending down for that. And then you add all our environmental exposures. So I think it's multifactorial. I don't think it's one thing, but I do think there are a lot of contributing factors. I want to add one more to that that's so
Okay.
interesting that most people can relate to is it's just like the phone we used to hang on the wall. We now have this little computer in our pocket. Well, our imaging has gotten so good that we
Yes.
are finding cancers that maybe would have gone away on their own and we never would have seen them. But our detection is so good that maybe we're finding them and they're not as important as we thought they were. And there's a fair amount of research going into that right now. Stage 0 breast cancer. Do we need to treat? Do we not need to treat? Which ones do we? Which ones
Okay.
we don't? And so I think this early detection is getting so good that it might be too good.
Interesting.
Mhm.
Might be too good. Well, okay, detection. Let's talk a moment about that because AdventHealth here, at both our Hendersonville and Polk locations, we have advanced imaging technology, which is fantastic. Specifically, we are able to do at our Hendersonville, at the hospital location for our imaging team, we have the ability to do 3D mammography with the
Contrast.
contrast, which
Mhm.
is something. I mean, it has been in the news, and I am one of those people who got the letter saying, "Hey, your mammogram shows you have dense breasts." So this is something important to me. Dense breast tissue, mammograms, and mammograms with contrast. Can you clear up all
Well, that's
can
a
you
big
answer the
topic.
million-dollar question? But what is access to
Well,
this kind of, imaging?
it's a little, more exciting, than just having contrast enhanced mammo. What's really interesting about this area is that they've been doing contrast enhanced mammo sort of in this area much longer than the rest of the country.
Yeah.
And that's exciting. So ARA is Asheville Radiology Association. They have been in the area for a long time. Advent uses ARA physicians and fellowship trained breast imagers. But the contrast enhanced mammogram is another tool in our toolbox to be able to detect cancers. So cancers make their own blood supply.
Mhm.
And when they make their own blood supply, if we put contrast into the blood supply, then we can see if there's a little bit of a density there and a little blood supply going to it. It's kind of like a blossom, a little
Yeah.
rosebud. We can say, hey, there's something going on there. And it's really increased our tools in our toolbox to be able to say that. But Advent Health, both in Polk and here, have the ability to do regular mammograms, which are important for early
Mhm.
detection and see things that other things can't see. They have the ability to do an ultrasound. Both for a targeted area as well as for screening. They have the ability to do contrast enhanced mammogram, and then the gold standard is breast MRI. So we have the full complement. You have the complement that you would have at Ohio State, that you would have at Wake Forest, that you would have in Charlotte, that you would have at UNC. And that really allows us to have the tools in our toolbox we need to be able to do what we need to do to have really world class care right here close to home.
That's exactly, what I think a lot of people wanna hear because that gives you a sense of calm and peace when you're thinking
Mhm.
about. I mean, there's always in the back of your mind, even if there's, no family history, if there's no issue or whatever, you're just having your regular mammogram, which, by the way, you need to have your regular mammograms if you fall into that age group.
Correct.
But,
But
there's
you
just that moment where you go, "What if?"
Yes, but you asked about breast density.
Yeah.
That's a whole different area, but it really has come into the news
Yes.
because the FDA passed a law this fall that said that we have to notify you of breast density. Part of the reason they passed that law is because now we actually use artificial intelligence to look at each pixel of the image to tell us how much is black and how much is white. The black
Really?
part of your mammogram is fat. The white part is the breast tissue and the walls of the breast. So in the past, we would look at your mammogram and say, yeah, you have dense breasts.
Uh-huh.
And that was a qualitative. We sort of guessed at whether it was dense or not. Now we have a computer that actually calculates how much density is there and gives you a category. So it's quantifiable. And so now we have very distinct categories. And so if you are category C or D, if you have 50 to 75% of your breast is white,
Mhm.
we could miss a cancer that's white too. It's kind of like looking for a snowflake in a snowstorm. We could miss it.
Sure. Okay.
Um, we also know that if you have increased breast density, your breasts are a little busier than everybody else's, and you are at slightly increased risk for breast cancer. So,
Okay.
because we quantified it, because we now have supplemental imaging to offer you if you are increased risk, and because we know that we might be able to alter your risk if you have that supplemental imaging. That's why it's been in the news. And that's where
Mhm.
contrast enhanced mammogram came in, because it can see through that density and tell us. But that's also where screening ultrasound comes in, and MRI. So all three of those.
All of the tools available here at AdventHealth
All the
that
tools
you are
available.
making use of. Okay, so we were talking a little bit earlier when I first introduced you, and we were talking about how you are one of the busiest people. You are not only providing that convenient and comprehensive, and I will openly say compassionate care. I see it in your eyes. I watch you
Mhm.
interact with people and patients. Um, you are providing that here as in your role as our breast surgeon. But you're also doing more. You're also helping lead our cancer services on many major initiatives. We happen to be, okay, I'm going to let you brag on us a little bit if you don't mind. Let me twist your arm. But we happen to be a very complimentary and comprehensive cancer service resource. And I'm just speaking specifically of the certifications and accreditations that we've worked hard for, because the bar's up here and we work hard to meet and exceed that bar. Let's talk about some of those and what it means to me as a patient.
So we'll talk first about the cancer accreditation for the
Love it.
cancer program. So we are a Commission on Cancer accredited site and have been for many years.
Mhm.
And what that says is that we care that we know what the national standards are for cancer care and we follow that. And the Commission on Cancer also has an external review process. So somebody comes on a regular basis and verifies that we actually are doing what we say we do. We're one of the only area cancer programs in the area that have that accreditation in Western
Yes.
North Carolina, and that's an important one. I have been at a COC center my entire career, or a Commission on Cancer accredited program my entire career, because I thought that that was important. It requires that the patient gets care from the time of screening all the way through surveillance and survivorship. And really, Advent Health provides that with their whole person care too. And so it's very complimentary.
Mhm.
But on the breast cancer portion,
Yeah, this is pretty impressive, I gotta say.
yeah, the breast cancer portion, not everybody is also a national accreditation program for breast centers. I've been a big proponent of that. I have been a part of that organization since they started in 2008, and I was a part of the initial criteria. What I found out in my first job is that I could be a breast surgeon. And when I interviewed for the job, they said they had a breast center. And I thought,
Mhm.
great, perfect. This is what I know. When I got there, there was a sign on the door that said they were a breast center.
Right? Right?
That was it.
Oh,
They had
no.
no components. And at that time, we had not defined what those components are.
Uh-huh.
So part of the national accreditation program for breast centers is to define what it means to be a real breast program. And so this organization is going on the third accreditation cycle. So this is their ninth year of being accredited with the National Accreditation Program for Breast Centers.
And let's tell people when they see when we put something out, from
Mhm.
the communications, or you might see a billboard or something, and when we say NAPBC, this is what you're talking about, right?
Correct,
So if you see
correct.
that seal,
Mhm.
that means we've done what you're gonna tell us about.
Yeah, so there are 32 organizations that say this is the best practice for imaging,
Okay.
for screening, for surgery, for pathology, for radiation oncology, for medical oncology, for survivorship, and so on. And so these organizations have defined that, and then we have to meet those criteria.
Okay.
And I think it's a really nice framework for patients to have the sense of security that we actually are doing what we say we do, and that we're an accredited program. And it is extra work for an organization.
It
It is
is.
an
I've
extra
watched your
cost.
team work hard for
Yes,
this.
it's an extra cost, but it's really good for the patient. So when my mother was diagnosed with breast cancer, um, I didn't let her go to her local hospital. I made her go to a national accreditation program for breast centers because I knew that she would get good care. So, she had a nice little early stage breast cancer, did perfectly fine with it, but, I knew she was in good hands when I went to an NAPBC center. So I even made my mother do it.
Well, if you're gonna make your mom do it,
I know.
honestly, that's great advice to be, as people who are looking for healthcare, we really are in a time when we can shop around and
Mhm.
be a consumer of healthcare. And understanding, having you as a physician tell me what all those letters mean when I see them on the door or on a pamphlet or something is really powerful. So we're looking for things that say, here, like you see here at AdventHealth, NAPBC. What are some of the other um, efforts that are made and achieved for certifications and so on that really make our cancer services stand out?
Well, we have the regulars. We are meeting the standards, but there is something special about AdventHealth that drew me towards AdventHealth, and that really is the whole person care. And the idea that we are trying to take care of them spiritually, physically, emotionally, and then also to make sure that they're getting standard of care. So I really think that Advent Health goes the distance with that. Our breast program, we are doing wellness walks once a month.
Mhm.
And we even have a walking trail around the hospital, which is also a sign. Like not every hospital took the time, energy, or the resources needed to make a walking trail,
Mhm.
both for their staff as well as their patients. But there's a walking trail around the hospital that we do that walk. It's only about a mile, but it's an opportunity for survivors plus one and their families to get together, see other survivors plus one, and just congregate
Yeah.
because we're all in this together. We're all walking this together. The other thing that the cancer program's doing for our survivorship series is we also have a garden project where we're teaching people
Yeah.
how to grow their own vegetables
Teaching
and
people, including the doctor herself.
including me.
You
So
are a
maybe I'll
budding you're
get
trying
better.
to turn these thumbs greener.
I am trying with this soil that's so different from where I came from
It
in
is.
Wisconsin.
Oh, sure.
But I wasn't very good in Wisconsin either. So maybe I'll get some skills. But that's been a fun project. We're helping a local pantry with the food that we
Yeah.
grow so that they can help feed our community.
Well, let's talk about that. We've got the wellness walks and you are there for that. We've got the gardening and this is something that was
Mhm.
near and dear to your heart. The other aspect of this is that these are all things that um, when the doctor is preaching, this shows that you're practicing what you preach to. There are things we can do in our lives to um, help us reduce the risk for cancer, help us improve our journey on cancer. What are some of the things? Obviously,
Yeah.
being active, eating healthy, but let's talk about what you would recommend and how
Well, we
help
can't really
people.
control when we have our first period. We can't control our family history. We can't control when we had our first baby, usually. Um, Having said that, there are some modifiable things we can do that really make a difference to decrease your risk.
Okay,
Watching your weight decreases the risk of 7 cancers, not just breast cancer.
7. Okay,
Limiting alcohol, no more than 2 drinks a week, is the current recommendation from the American Cancer Society to decrease your risk of breast cancer, but also other cancers.
okay,
We know if you stay active, walking 20 to 50 minutes 3 times a week decreases your risk of cancer. We know if you eat your fruits and vegetables, the current recommendation is 2.5 cups a day, which is a fair amount. That's like a couple servings each meal, decreases
sure.
your risk. We know if we get vitamin D, I will say down south here, it's a little bit easier to get that
I was
sunshine
I
from
used to
12 to
live up
2.
north too,
Yeah.
in Michigan. I know
Yes.
Wisconsin doesn't have a lot of sunny days either.
No. Or taking a supplement. If you're just living under fluorescent lights all day, taking a supplement. And then good sleep, which is a hard one, especially if you have young kids or you have busy lifestyles. So, good sleep, at least 4 continuous hours a day, decreases your risk. Those are all modifiable things we do. And they're all sort of interconnected for good health no matter what, whether it's
Yeah.
heart disease or cancer or so on. The common denominator seems to be inflammation.
Inflammation, and that is something that plays into heart disease, it plays
Mhm.
obviously into cancers, it plays into joint
Diabetes.
pain,
Mhm.
diabetes, and
Mhm.
so on, all of those things. So,
Mhm.
huh, those things you just recommended, doctor, might be good for all of us no matter where we are in the health spectrum, right?
Which is why Advent Health is all about whole person care.
You're
I mean,
absolutely
it's
right.
so interesting. It's almost simple,
Yeah.
and yet we make it so much more complicated, by our diet and lifestyle and so on. But I will say down south here, you can be outside almost every day, and that's amazing compared to up north. Yeah,
Okay, we're getting a little close to time here, but you were talking, the transition. You did come to us from Wisconsin.
I did.
And let's talk a little bit about where you grew up because earlier we were talking before we started the podcast, and you were talking about how the very thing you just said that drew you to Advent Health. The whole person care, body, mind, and spirit was something you grew up with and you've lived with it your whole life. So let's talk a little bit about um, what what do you mean? What was the
Well, so
correlation?
I think everyone had maybe some COVID aha moments
Yes, a couple.
Um, I think we all had some COVID aha moments. But when you get down to what's important to you, I grew up in a big family myself. I had 7 brothers and sisters.
Wow.
I know, big family, and family's always been important. Connection's always been important. I had 2 kids who, ended up in North Carolina, and, it became important that we were, a part of their lives too. And
Sure.
so I think that connection and family is important. Also, my patients inspired me. I saw lots of people who got cancer who turned their life around and what they ate and what they did and so on. And
Mhm,
I remember distinctly a few patients inspiring me to say, okay, I better start doing what I say we should do.
mhm.
And I started working out and exercising. And so when we were talking about moving to closer to where the kids were, part of that decision was where can we actually be outside enjoying nature most of the year? And it's
Sure.
not in Green Bay, Wisconsin.
Now, beautiful place,
Beautiful
but
place.
no, you're
Um,
right on that.
I get cold. Yes, I would snowshoe. Yes, I would cross country ski, but it wasn't quite the same as being able to be out and about, even
Mhm.
if it's a rain jacket on, to be able to be out and about. And for sure, our dogs love it here because they are out and about all the time. But I think that exercise, I think family, I think connection and community are all so important. And and I think it's, what my parents showed us when we were growing up,
Sure.
and it's what we like, it's part of what I think drew me to this place too. We had talked earlier about volunteering too. Um,
Right, so important because that has some health benefits as well.
it totally has health benefits, and, my mother would show us. My mother, worked for Catholic Social Services before she got married, and then we housed unwed mothers for years,
Really?
and then we would distribute day old bread to people who needed it when I was growing up. We always did the Thanksgiving, gather the food for people. I spent a lifetime until I went to college on some adventure in some way, volunteering throughout my life. And I realized how we are all a part of the community and we can all take care of each other. Part of breast cancer care that I've seen through the years is it brings out the best in families in general. I
Wow.
get to see the best in families. We talk about on the news, oh, the families being destroyed. Oh, no. Oh, no. I get to see the best in families. I get to see families support other family members every single day. Now, you can call it family as you define it. It may
Sure,
not be,
absolutely. They may not
it's
be blood relatives.
right. But I mean, like, it's community taking care of community. And I get to see it every day. I mean, it is amazing. So, I'm not worried that community knows how to take care of community because I see it all the time. Yeah.
You know what? I think that is a great spot for us to stop for now. You know I'm gonna call you back here for another visit because we could talk forever, which I
Yes.
love. We could just go on and on. But you know what? I really wanna say a thank you to you, Dr. Colette. By the way, she lets everybody call her Dr. Colette,
Yes,
or is
please.
it Colette?
Oh, either one.
Really?
Yeah,
Cowlette.
Cowlette has been out there. People call me Colleen, Charlotte, you name it.
I get a Valerie and a Virginia every
I
once in a
know.
while.
You just go with it, right? You just go with it.
Well, no matter what way we choose to say your first name, we do want to say thank you, Dr. Colette, for being part of our team here at AdventHealth, but more important, being part of our community. You have already been such an influence, and we can't wait to see what comes next.
Thank you.
Uh-huh. Well, folks, that does it for this edition of Live Better, Feel Better. Be sure to visit us and check us out next time we get together and connect over this AdventHealth podcast. We'll see you next time.